Good morning, guys. It's Tuesday. I have a busy breast day today, actually doing 4 different types of breast surgery today, doing a reduction, a lift with implants, an implant case, and then a reconstruction after mastectomy. So really the full gamut. And I actually want to talk today about the difference between augmentation with breast implants and with fat, because they're totally different. I've been getting a lot of inquiries about this. The idea of being able to do liposuction and fat inject the breast is very appealing to women, thinking that they can avoid implants. In addition, there's a lot of scare about breast implant illness, and women are afraid to have breast implants. So let's just dive into the difference real quick, okay? You really, to determine the best option for you really requires a consultation, and you really have to understand what kind of breast tissue you have and what kind of desires for an end result you have, okay? So what do I mean by that? Some women that we do breast reductions or breast lifts on look like they have implants by the time we're done. And the reason for that is they have very dense breast tissue, which is fibrous breast tissue, as opposed to fatty replaced breast tissue, which occurs more commonly after kids. And if you have very good skin quality, so if you have really good skin quality and you have dense breasts and you do a breast reduction or a breast lift, it's gonna look almost like an implant because it's very solid in there. Whereas a woman who has fatty breast tissue or loose skin or any combinations, they tend to go together, the breast is just not gonna sit as high on the chest, it's gonna drop to the bottom, and it just will never be as full on the top. So those women are more likely to choose an implant to begin with to give them upper pull fullness. So now, going on specifically to breast augmentation with implants versus fat, you have to really talk about the upper half of the breast and the shape change. So the best way I describe this to everybody is if you're happy with your shape, then an augmentation with fat alone will just enlarge your natural shape, and really you will not get a shape change. Whereas with implants, you're gonna get a complete shape change, especially in the upper half of the breast, to give you fullness in the upper half of the breast. So up here is what we're talking about. You can try to inject the fat there, but the reality is it won't stay there. It will just go into the breast itself. You also have to be very careful with women who choose to do fat into their breast, because you have to realize that with weight gains, the size will increase or decrease. So if you have not injected the breast correctly, symmetrically throughout the entire breast, you can just get enlargement just in the upper half, which can actually look abnormal. Also, you have to remember all the fat doesn't take. We can only augment about 110% of the volume of the breast. So if your breast is a 400 gram breast, we can put about another 400 cc's of fat in there, but in reality, we don't know how much is gonna stay. About the best outcome we can get really is to get about a 1 cup size increase at best result. Okay, and that's the best I've seen to date, with over 2,000 fat injection cases being done, which I do regularly for my reconstructive patients as well. So you just keep those expectations in mind. It's very unpredictable. If you want fat injection in your breast, you're gonna have to go through an aggressive liposuction procedure. So keep that in mind also. I tell my patients, look, if you're having liposuction and you wanna put the fat in your butt or in your breast, that's great. But if you're gonna try and go through an entire procedure just because you want fat in your breast and you didn't necessarily want liposuction, you're gonna spend a lot of money and the results may not be as predictable as you think. So you have to keep that in mind. Implants, on the other hand, give us predictable size increases and will stay exactly where we want them to. So keep those things in mind when you're considering implants versus fat. If you're deflated in the upper half of the breast and the goal is to increase that, you're gonna need an implant. If you like the shape of your breast or you're not too deflated in the upper half and you still need a lift, then you might be a good candidate for fat. Also keep in mind, I've seen a lot of bad outcomes from fat injections. Not a lot of people really know how to do these correctly. I see them injecting into the breast material, which can create what we call fat necrosis, like hard spots in there. I've seen significant areas large like golf balls from people doing that, just trying to shove fat in different areas. So you really gotta know where you're doing it. You gotta understand that there can be some mammographic changes. Usually they're very minor and experienced hands, and the radiologists know the difference between the two. So hopefully that clears things up. Let me know if you have any questions, and I'm gonna get on to my second case today. Thanks.